Queen's is a fairly unique university in that it offers every field of nursing as well as midwifery. We're also really proud of the fact that in the last year we have been in the QS World Rankings Top 50 School of Nursing and Midwifery, so that really confirms our status as a premier nurse education unit. As a school, we're very focused on delivering a programme of excellence in both teaching and research. The professionals that come out of our programmes are equipped to deal with not just healthcare in 2018, but in the next few decades ahead of their career. So we invest heavily in interprofessional education, in state-of-the-art simulation, and very importantly in a blended learning approach. It is really exciting to work in a school where the focus on high quality teaching and research are really a priority for all of our team. It was really gratifying, for instance, last week that one of our team members, Maggie Bennett, was awarded a Most Inspirational Teacher Award in the Students' Union, because that kind of shows that our students in particular, who are main consumers, really appreciate the quality of what we do. We include all fields of nursing: adult, children's, learning disability and mental health, and that very importantly positions us as a school where people can come to avail of a whole scope of nursing programmes. I'm very confident that we have really excellent teachers within the school that are equipping our students with the very highest in terms of knowledge and skills that is required to meet the challenges in healthcare delivery. We're developing a new undergraduate curriculum that will be really ambitious in its innovation and trying to reach new standards of excellence in terms of healthcare delivery.
Here we teach undergraduate, postgraduate research and postgraduate taught courses in nursing and midwifery. So the core training programme really aims to look at the training that's required for every single student. So for example, ethical processes that all students would have to go through. But we really pride ourselves in having a very reflexive approach to additional training requirements, so that if there's a specific area pertinent to one student's study, that we could then develop training specific to that. The postgrad research students within the school are really working with us as colleagues, and we work together as a team on their research project. A PhD is a journey that lasts for 3 years, and life invariably happens inside that 3 years, and we do take a very supportive approach with all students to ensure that we meet the holistic needs and not just the research needs of the students. We have 3 core research themes: maternal and child health, supportive and palliative care, and also education. We're very open to topics and where they fit within those core themes. There is, for example, methodological expertise that lies across all of our research themes. So if a student had a topic that didn't particularly fit into one of those, but we had research methodological experience within the remit of what they wanted to undertake, then we would be supportive of accepting that student. We have a very active and vibrant postgrad research community. About 1/3 of all our postgrad research students are currently international students, and we would be known for our work internationally, but also our work here that's internationally relevant. And just to give some examples of those projects, we have women's experiences of maternity services within the Kingdom of Saudi Arabia. We have a study that's looking at understanding breast health awareness within an Arabic culture. We have a study that's looking at newly qualified nurses and their experiences of working within Kuwait. And we also have a project that's looking at evidence-based practice in children's ICU, again within an Arabic culture.
We have a variety of approaches to delivering the teaching on the programmes. So that could be the very traditional face-to-face, although we try to blend that with other areas of learning. So online learning, blended learning, learning with the simulation and OSCEs. We use the SimMum. For example, we had a recent cohort of students there actually use Skype in the classroom. So we collaborated with a university in Uganda. So we had a group of midwifery students who were undertaking a public health module, and they talked about the public health requirements and profiles in each of the countries, so Uganda versus NI. So that was very well received. We also use interdisciplinary learning, so that's very important to us. The maternity care team involves many professional layers. That could be an obstetrician, it could be a physiotherapist, it could be a psychologist. So it's important for our students to be exposed to that in their training and in their learning environment, so that they're very familiar with that concept of being part of a team and working as part of a team. So we value that very highly in our programmes. We keep ourselves updated, obviously. Members of staff are members of different groups, key stakeholder groups around Northern Ireland and also the UK. We feed in at NMC levels, so we have a member of staff who feeds directly in there. We also liaise very carefully with our trust colleagues, so that's across the 5 health and social care trusts in Northern Ireland. The placements are varied on the programme, so they can be across antenatal, postnatal, community areas. We also have the facility for students to undertake international placements, so they can take an elective placement in their 3rd year and they can choose to go off to Malawi, Uganda, wherever. It could be in the UK if they would like to see a different birth environment than we have here in Northern Ireland. Service users from, say, Parenting NI, Tiny Life is a local charity that we do a lot of work with. For example, we would invite members of those charities to come in and actually talk to students. So we work with charitable groups out there in the sector that actually work with women, so we hear their stories and they come in and teach our students and tell our students about that, so the students know firsthand.
Our research always begins with our collaborators, our clinical collaborators, the trusts, our community collaborators, charities, and that helps us to reach our research back into practice, whether it's for the patient or indeed whether it's our health promotion sites such as our schools, our prisons and the community in general. Our 3 themes are maternal and child health, chronic illness and palliative care, and our recently formed theme, education and practice. In relation to maternal and child health, our work here covers kind of 3 broad areas, if you like. Number 1, it's about early intervention and prevention programs. And some of this work actually is about education in schools around relationship and sexuality education. Then some of our work is more directly midwifery research, which is really about improving care outcomes for women and their partners around the time of the birth of a child. And the 3rd area in maternal and child health is really following up longer term outcomes, especially for children who may have particular needs. So for example, children with brain injury or children with cerebral palsy. One of our projects here is led by Jenny McNeil, and it's about bringing together midwifery-led care in clinical areas with the health visiting care that one might receive in the community and joining those up together. And Grant's work is very interesting in relation to maternal and child health. She has developed, along with colleagues in Australia, a model called Family Focused Practice to address the needs of parents with mental illness. And I guess what's novel about this approach really is not just treating the patient, where the nurse comes into the home and just speaks to the patient. This approach is really about building a rapport with the parent and the children. So another example of our research impact is the work we do in schools and prisons. So this is about developing relationship and sexuality education for the children in Northern Ireland. So some of our work in relation to this is about developing relationship and sexuality education to prevent unintended pregnancies. And what's novel about our work in this regard is that we've targeted our programmes towards young men who are frequently neglected as partners in preventing an unintended pregnancy. Our work has also been innovative in terms of reaching out into hard-to-reach men, such as men in prisons. Midwifery-led care is an idea that has been around for quite some time, and the research around why we should do it has been around for some time. But Maria Healy's work is, I suppose, helping to get it out into practice, because she has developed the guidelines for clinicians to be able to steer them in relation to which women should go down the route, or which women should be offered the choice to enter into midwifery-led care units. So working with the trusts right across Northern Ireland, she has developed the guidelines for midwifery-led care and is currently evaluating them. This also has international appeal, because midwifery-led care is understood to be a way of enhancing the care provided to women and their partners, and especially women and partners in most need across the world, where health services may be underdeveloped. Our research in relation to chronic illness and palliative care is, I think, particularly innovative because for example, in relation to palliative care, it's about taking the idea of palliative care which was developed most clearly within cancer care and taking it into areas where there's need. So for example, Kevin Brazil's work leads the way in developing palliative care for patients and their carers with dementia. And also Helen Noble's work in this regard is very innovative in relation to providing palliative care for patients with end-stage kidney disease. Also, more broadly, our work on chronic illness, I suppose, is about improving health and well-being outcomes for patients with chronic illness. So it's about often self-management of care, especially around cardiology, but also around areas such as cachexia, which is really about managing nutrition in cancer care. I think it's really worth highlighting the work of Olinda Santin and her team. They have developed the most fantastic internet resource for carers of patients with cancer. They worked for a long number of years with some of the leading charities here in Northern Ireland, such as Cancer Focus and Macmillan. Now they have developed this internet-based resource, which is accessible to cancer caregivers at any time. But I think what's special about it really is the ways in which cancer caregivers were very much at the heart of this project themselves. And this resource has developed patient narratives, but also caregiver narratives about what works for caregivers in this situation. In relation to education and practice, that's really about developing and evaluating the best ways in which we can teach nursing and midwifery. For example, my colleague Karen McCutcheon has led a randomised controlled trial of a study to look at how we can best teach clinical supervision skills within nursing at undergraduate level and continue those out through continuing professional development. And also my colleague Marion Traynor is leading a study in relation to how best we select people to come into nursing and midwifery using multiple mini interviews. But I suppose the special need around this really is to include greater diversity within the nursing and midwifery profession, including men. Caring is something that everybody can do. Caring is a noble profession, and we welcome men and women into the profession.
The key thing with Queen's University is we're well positioned internationally. We provide a top class approved quality nurse education provision, and when students come from all around the world to Northern Ireland to come to Queen's, they value that experience and they bring that experience back with them. Nursing is international. We began the process in Southeast Asia. We had a cohort of students came from Brunei. It's now stretched right across the Middle East, the Far East, and other states in Europe and North America as well. They bring a different way of thinking, different religious background. They bring a different language. They bring a different culture. They enhance the nurse education programme because we're no longer talking about what happens drawing from textbooks. We're actually drawing from practitioners who are delivering health and social care in those particular countries. They bring those experiences to Northern Ireland. They tell us about them. We share with them what we do here in Northern Ireland, and together we create a synthesis of ideas. From the outset of our internationalisation strategy, we firmly believe that it wasn't just of value to come along and undertake an academic programme without offering them the opportunity to practice, not to just stand at the bedside observing nursing care, but to actually deliver hands-on care supported by a qualified nurse. They then can align that with instruction and teaching they've received at Queen's. So therefore, one supports the other. Theory supports practice and practice supports theory. Our international students now regularly go to all areas of nursing care in Northern Ireland. They regularly visit cancer care services, intensive care services, theatre and so on, and derive a really valuable benefit which is captured in a portfolio of evidence and helps them in their theoretical understanding of nursing practice, helps them in their assignment construction, and in the end improves their academic award, therefore making them a much better product returning to their home country.
At the moment we're engaged in a really ambitious recruitment drive within the school in terms of both education and research staff. We're very clear about what we offer here in Queen's and what the School of Nursing and Midwifery ethos is. A key component of our success in that regard has been treating all staff with equality and making sure that there are opportunities available to staff to develop and grow as individuals and as professionals. One of the ways that that has been evidenced most clearly in the last few years is the retention of an Athena Swan Silver Award for the school. That's really a hallmark of an environment where staff are given opportunities and where equality is fundamental in everything we do. So I think it's fair to say that the people who have come here see within the school an environment that is very supportive, that offers them the opportunity to grow and develop professionally and help them build up a programme of really cutting edge, highly competitive research that is able to make a difference. We offer a very friendly environment. People like the culture, they like the state-of-the-art facilities, the nice open buildings. They love Belfast, they love the campus, and they love the good schools, the social life, the lifestyle choices that they can make, and the opportunities they can have here for building their career. Also for new students, they can be assured here that there is an excellent learning environment, that the quality of our teaching, the quality of our research really is world class, and that they will come out of this institution with the skills and resources that allow them to become successful, ambitious practitioners in healthcare for the future. I wish a warm welcome to anyone who is considering coming to Queen's and the School of Nursing and Midwifery, whether it is as a member of staff or as a student. And I can assure you that you will meet here a team of dedicated professionals who are very, very focused on making sure that your experience is really world class.